So what is a deep cleaning? A deep cleaning, also known as scaling and root planing, also known as gum infection therapy, is a procedure that we do if your gum health and your bone health in your mouth around the teeth aren't quite up to par. So basically, whenever we check your gum health, we use this instrument called a periodontal probe, and it's kind of painful. It's like us sticking a metal rod underneath your gums, which is happening, sorry. But it basically measures the depth of your gum tissue. Healthy gum tissue is between 2 and 3 millimeters on average. Inflamed gum tissue is 4 millimeters or more. And so if you're hearing your dentist, typically once a year we'll measure this. If you're hearing your dentist or your dental hygienist call out 4s and 5s, then you might be on track for getting a scaling and root planing or gum infection therapy, deep cleaning, okay? So basically what ends up happening is, see the 2 teeth that are brown there, your hygienist basically has to scrape that off. Imagine like barnacles on a boat. It's like a hardened piece that's on another hard piece that requires scraping. And so typically we numb you up a little bit for this, and we will scrape underneath the area to get rid of the infected tissue off of the tooth and off of the gums a little bit, so that your gums can heal. Whenever you have a 5 millimeter pocket, it's almost like you're not cleaning the area even if you floss. And so that's why I guess we have a profession, because if you're not brushing those teeth in those areas, we come in like the heroes that we are and we try to save the day. And so these are pockets of bacteria, and so that's why some may call it gum infection therapy. Typically afterwards, when you do get your cleaning, you want to see resolutions. So ask your dentist, like, hey, we did the scaling root planing. Did the gums resolve? Because if they haven't, they do require some extra attention. And so this procedure is here to remove a lot of the bacteria within our mouth. The scaling and root planing procedure speaks to another problem, which is inflammation that is in our oral cavity. So basically, the oral cavity is the beginning of the entire digestive system. If you're eating, in a sense, inflammatory things, that's not good for your gut, and it's not good for your overall health. It actually increases the risk of coronary artery disease, strokes, heart attacks, things of that nature. It makes diabetes, cholesterol worse, so something to consider. Thank you for watching the video. Again, knowledge is power. A lot of times, sometimes a little bit of extra information gives us the motivation and knowledge to be able to change our own behaviors. And so I hope you found this video helpful to you. Here at Atlanta Dental Team, what we really care about is our patients and our family. And so we really want you to gain all the knowledge you can so that you can make the best decisions and save the most money, obviously. Keep your mouth healthy and have a blessed day.